Yeah, that's like
alarming.
Yeah, 60 a year.
Yeah.
More than 60 a year.
The job of the Alberta Child and Youth Advocate is to investigate deaths and serious injuries that happen to children and youth who are under the protection of the province's intervention and welfare services, and give that child a voice and find solutions to prevent future incidents. Each year, a report is made available to the government and the public with those recommendations. This new report goes back to when the office became independent from the government in 2012. Indigenous people make up 6.5% of Alberta's population, but make up 57% of the 634 deaths or serious injuries reported in the past decade. That averages 36 deaths or serious injuries each year for 10 years. APTN asked the child advocate, Terry Pelton, what her biggest concerns are.
What we're continuing to see is that child intervention or child welfare services continue to be over-involved in the lives of Indigenous young people and their families. We see a number of suicides, a really concerning number of deaths related to substances and opioids. And it continues to be a problem for young people transitioning away from children's services care. They don't have enough supports, and so we're seeing really an increased number of young people between 18 and 22, 23 passing away.
Pelton says that governments need to help Indigenous communities work to keep their youth at home.
Nations need to be supported to take care of their own kids. There was legislation enacted, federal legislation, about 2 years ago, and which allows them to care for their own children and have their own child welfare laws. The government needs to support them to exercise their inherent rights to care for their kids.
She says more supports are needed for youth who age out of the child welfare system. Too many are dying of overdoses and suicide.
They need tailored supports and services specific to who they are and what their individual needs are, and they need ongoing supports. So just like you, if you had your children, you're not sending them out the door at 18 and expecting that they're not going to have additional supports, or even at 21. Their brains are developing right up until their late 20s, and they need extra help.
APTN asked if the Alberta government is doing enough to implement the recommendations from the office.
They're doing work towards implementing the recommendations. Most recently, we've seen a number of our recommendations get stopped. They've said that they aren't going to provide further updates, that they feel they've met our recommendations. And when my evaluation committee has looked at their responses, they haven't been adequate for us to assess that they have fully met that recommendation. So I'm pushing a little bit harder and hoping for more transparency between the ministries and government, so that the public can be part of those conversations.
Chris Stewart, APTN National News, Edmonton.